Trying to think of what's the health definition for us. And when I say for us, I mean for UOC and mainly for the eHealth Center and for the School of Health Sciences here. My slogan will be this one here. So health will be digital or it won't be. So 2022, or 2023, sorry, but I lost two months in my life. Where are we now? So this is a kind of idea of where are we, mainly in high-income countries, mainly in Europe. So sorry, but I am talking about my context. That's something I know much more than other contexts in the rest of the world. So what do we have to consider? The situation now, we have people aging, we have the importance of the climate emergency, that's worldwide, of course, the high impact of chronic diseases, as we were talking this morning, all the issues about mental health, infectious diseases also seem not to be longer a problem in high-income countries, and wow, suddenly they are, and don't forget about resistance into bacterial resistance. Yeah, that's it, sorry. So society nowadays is facing many health challenges, and the health care systems are really overwhelmed and are suffering from a big burden. So the burnout of the healthcare professionals is a huge issue, I think, worldwide too. So health costs are very high. We are also having very expensive drugs that are not available for everybody in the world, and the costs of these drugs are very high for the healthcare systems too. We have had this COVID thing that we all know about, and we have learned some things about this COVID-19, and one of the things is the difference of the impact of the pandemic depending on the economic status of the population. And when I say population, I mean country, and I mean people living in different areas in the same city. As Paul was saying this morning, the situation from Bondi Beach towards the inner part of Australia, that maybe you were talking about a very huge difference in life expectancy. This is also has been studied and analyzed here in the city of Barcelona. And the slogan at that moment when it was analyzed, it was that only 4 underground stops separate 10 years life expectancy difference. So this is a problem also here, let's say. Okay, so we have this situation, but you also have opportunities there. And the opportunities are that we need a paradigm shift. So health is something that has to be managed in a very different way. And when I say health, I'm not saying only disease. That's something that when we talk about health, we are thinking of the health system. We are thinking about hospitals. We are thinking about diseases. But this is disease, it's not health. So when we talk about the health status of the population, we have to consider health and not only disease. So we want this change of paradigm, and we want the population to be proactive and the healthcare systems to be proactive and not reactive to a problem. We really dream of a healthcare system which is predictive, participatory, with a coordination of care, preventive, personalized, and last but not least, patient-centric care. So we really think that digital skills, digital tools can help us in achieving this shift of paradigm. So yeah, there's a lot of literature about definition of health, and there's a lot of literature about definition of eHealth. Even if we try to differentiate eHealth from digital health, I'm not gonna go into these academic discussions that sometimes are nice, but I don't know if they are giving really a lot of value. But some years ago, when we start, Marta will explain about UOC tomorrow, or I don't know, today. When we started to conceptualize the eHealth Center at UOC, we were talking a lot about what does eHealth mean. And suddenly we found a paper from somebody in Sydney that maybe Paul knows, is Tim Shaw, in 2017, and we said, yeah, that's it. That's what we think that eHealth should be, and that's what eHealth can really bring to this shift of paradigm. So what is the model defining by Tim Shaw is 3 overlapping domains that are here, and that means the use of digital technologies to track and inform, the use of these technologies to facilitate and communicate between different health stakeholders, and the use of data to improve health at individual and at population level. So having health in our hands, we all have our smartphones there, interacting for health and having this data. So all this should help us in this change of paradigm. I'm gonna wait because Marco is just taking a picture. But what happens with that? Which barriers do we have? Which barriers do we have? So about digital health, we have lack of clinical effectiveness. We have also studies that needed about cost effectiveness, heterogeneity in healthcare systems. We have resistance to change. This is something very much human. So everything new, sometimes we can say, oh, wow, that's nice. We are really like the light now for me. But then it's, okay, yes, but we prefer to do things as usual because we are used to do that. And changing things sometimes is, wow, so difficult. Also, let's say decisors, governments, or people who has the power to make things happen need to really have these implementation strategies. And we need also standard evaluation frameworks. So digital health strategies sometimes it's not clear if they are really giving added value or not. And the challenges, so what about ethics? What about equity? So all these digital health strategies, are they available for everybody? Are they equitable? How can we implement them? And what happens with those who have to implement them? So the healthcare workforce. So how can we help the people so that they are not even more burnout with extra stress? So the potential impacts of the digital health in society is empowering citizens and having less inequities. We think about that. Healthcare professionals, we think digital health can help them to be more informed and more responsive, healthcare systems more efficient, and integrating health and social care. This is for Europe, nothing. And about governments, improve transparency and evidence-based policies. But what's going to happen? That's where we were when I did these thoughts. That was the end of 2022. So in 2050, where we'll probably be? Probably we'll have 1,000 million terabytes of data. But algorithms in artificial intelligence are going to be clear and transparent? Or what about this black box that we talk about always? Who will take decisions? And these decisions will then be taken based on really data and evidence, or on what? Are we going to have better gene therapies, better predictive medicine? What's going to happen with the efficiency of public healthcare systems? So those are questions that's going to be related with data. What's going to happen with society? That's not my dream, but maybe this is something that can happen. That maybe we will have worse inequities. The health sector will be completely business-oriented. Will we have better empowered people? We don't know what's going to happen. But these are question marks that we should really tackle. About the systems, this I like it very much because it's something under discussion. In fact, there was on Lancet 1.5 years ago. Are digital technologies a new determinant of health? So in this diagram about the social determinants of health. Are we going to include there the digital technologies? Having access to digital tools is going to be salutogenic, or what's going to happen with that? So the healthcare system needs new professional roles, new collaborating strategies between different stakeholders in the society, for sure empowering primary healthcare settings, and that's not new, that's been said for a long time. Maybe we will have, or we will need, liquid hospitals, and what's going to happen between the skills, digital skills, who will have them, and what's going to happen between this gap between those having these digital skills and those not having it. What about the context? So in Western or high-income countries, a lot of people is going to be over 80 in 2015. Me, I'm going to be 80. So, yeah. Is there going to be an epidemiological transition? What happens with planetary health? So we are living, we know that, a climate crisis nowadays. What's going to happen? Are we going to be able to revert that, to mitigate the impact of that? So what's going to happen with all the data will we have? That's not health, or yes, it's health, because depending on the context and the political context you live, your health is going to be one or another. So is it a fear for democracy? Is it going to be the population under control? What's going to happen with all these things? But where do we really want to be? Where we want to be is here, that we really have more justice in our society, so more equitable and sustainable society with higher resources invested in health promotion, so being proactive and not reactive, with more sustainable healthcare systems. This seems the logo of the cluster, thinking locally with more global justice, more transparent, and more aware of social determinants of health. We also want healthcare professionals to be not robots, but to be coached, probably. We need people, humanized people, to really do their work, not to do the same that can be done with a computer or with a robot. That's a challenge. It's very often people say, oh, maybe in 2050 there's not going to be any more nurses or doctors because they are going to be substituted by artificial intelligence. No, the answer is those not using artificial intelligence, maybe they will disappear. So use the tool, but be a human body. That's what the society needs, really. So we have a challenge in the natural language processing, data-driven decisions, hospital at home, quality of life, personalized medicine, and prioritizing also population approach and not only individual approach. So what do we want? We want higher health literacy among citizens. We want also higher eHealth literacy among healthcare professionals. We want to achieve shared decision-making process and participatory health for all. So at UOC, what do we do to achieve this? I'm going to focus in the School of Health Sciences because I will leave UOC eHealth Center for Marta whenever she can explain that. But at the UOC, we have tried to just give our inputs to achieve this world we want to have in 2050. How? So working mainly in a health system which is person-centered and trying to do research and training in the areas you have here. Which are those areas? Those areas, more or less, are aging, healthy aging, and we have here Marco that will explain something about that later. Women's health, neuropsychology, food, nutrition, and physical activity, epidemiology and public health, for sure eHealth and digital health, and planetary health that we have Christina here that will explain you more about it. So our research is mainly focused on those areas in order to improve the knowledge and to define conditions for this world that we are dreaming to have in 2050. So we try to put some steps after the others with the small, we are small, we are young, not in terms of age, but in terms of history in the university of the research. So we do our best to improve that. And we try to balance research and training at the same time. So all the research we do in this, in fact, social determinants of health, we try to translate them into our training programs. And that's all I wanted to share with you. So thank you very much.
Thank you.